Let's take a look at the kind of medications you may be prescribed to treat the GI symptoms of Crohn's. I've reached Joan, our expert gastro nurse, who's going to take over for me.
Hi, I'm just finished my shift here at the Foothills Medical Center, so it's a good time to chat.
Now, many of my patients use one or more of these medications to manage their different Crohn's symptoms, so I'm very familiar with all of them.
The drugs we're going to discuss are used to treat symptoms
In your GI tract that aren't treated by the anti-inflammatory medications and surgery mentioned in the other parts of this section. So let's get started with a
treatment for that pesky symptom that can ruin a perfectly good outing, diarrhea.
This group of medications is known as antidiarrheals, and they come in various forms and strengths. For mild to moderate diarrhea, your doctor may recommend that you take a fiber supplement to help bulk up your stool and make it less watery. This might include a psyllium powder like Metamucil or a methylcellulose product like Citracel. If you have more severe diarrhea, a drug called loperamide or Imodium may work better for you.
As with any new treatment,
It's a good idea to talk with your doctor first before you use any antidiarrheals. Specifically, these products may increase your risk of developing a condition called toxic megacolon, which sounds like a monster Godzilla might fight, but it's actually a life-threatening inflammation of your colon.
On the complete opposite end of the treatment spectrum
Are the laxatives used to help treat constipation. Constipation can be a symptom of Crohn's, especially when
swelling narrows your intestines and blocks things up a bit.
What you need to keep in mind with laxatives is that your intestinal tract is more sensitive than normal, and some of these products, even those available without a prescription, may be too rough on your system. Be sure to talk to your doctor before taking one.
You may also have to deal with different levels of pain from time to time with Crohn's.
When you're suffering from fairly mild pain, you may be recommended acetaminophen, which you also know as Tylenol, and other brands. But be careful not to make a regular habit of medicating yourself with painkillers, since they're not all the same. Most of the other available painkillers are non-steroidal anti-inflammatory drugs, or NSAIDs, including aspirin, ibuprofen, which you know as Advil, Motrin, and others, or a drug called naproxen, which is also found in Aleve. Sure, these drugs may be effective against pain,
but they're actually capable of making your Crohn's symptoms worse because of how they work in your gut.
These drugs should be avoided if at all possible, and it's important to let your doctor know if you're taking any of the over-the-counter medications.
You may also get a recommendation to use
Ointments or suppositories if you develop hemorrhoids, which is an irritating condition involving inflamed anal tissue, and you may try a non-prescription ointment for the job, with most of them containing a steroid to help shrink inflamed tissue. Another thing to try in this case is a daily sitz bath, which can help calm tissue around a crack in that sensitive tissue called a fissure, or to reduce muscle spasms in your pelvic area caused by inflammation. A sitz bath is a small tub that holds warm water mixed with some salt or baking soda. You sit on the bath for 10 to 20 minutes to soothe your bottom.
And applying zinc oxide or baby ointment after a sitz bath when you've got anal itching can help to soothe and protect the area.
Speaking of supplements, they are also used to help treat some secondary consequences of Crohn's. If your Crohn's causes your intestine to bleed regularly, you may get anemia because of lower iron levels. In this case, your doctor may recommend that you take iron supplements. Many people with Crohn's also take a calcium supplement with vitamin D, since Crohn's and steroid treatments can up your risk of osteoporosis, which leads to weaker bones. For some people, vitamin B12 shots might be part of treatment, especially when a part of the small intestine, called the terminal ileum, is inflamed or surgically removed. B12 helps prevent anemia, promotes normal growth and development, and is essential for proper nerve function.
And that's it. We've covered most of the strategies for treating GI signs and symptoms.
Thanks a lot, Joan.
It was my pleasure.
Great. Where else would you like to go in this section? Or perhaps you'd like to go to another section entirely?